Let's talk about how to reduce or minimize the side effects from chemotherapy. There's three big problems with chemotherapy. Number one, chemotherapy does not differentiate between healthy cells and cancer cells. It destroys them both. Number two, it creates significant side effects that are sometimes even worse than the cancer itself. Here are some side effects: fatigue, hair loss, bruising, infection, secondary infection, anemia, nauseousness, vomiting, loss of appetite, diarrhea, reactivation of viruses like herpes, weight loss, not the good kind of weight loss that you want. I'm talking about loss of muscle, and mood changes. Number three, it weakens the immune system. With chemotherapy, there's a high rate of cancer returning because you're also lowering your ability to recover. So whether you decide to use chemotherapy, alternative type therapy, radiation therapy, I want to at least give you some things that you can do to minimize the side effects and handle the damage control if you decide to go the route of chemo. Number one, realize that cancer lives on sugar and glutamate, which is an amino acid. And if you look at the strategy of starving off the cancer, that might be a very good strategy. And I'm talking about going on keto, reducing your carbohydrates and sugar, and also reducing the amount of glutamate in the body. The problem is glutamate is in so many different foods, but it's not in fatty foods. So some people, they go up with their fat, a smaller amount of protein, and sometimes they use an amino acid powder instead of actual protein, which gives them the key amino acids that they need without too much glutamate. And I'm going to put a link down below which shows some fascinating data on cancer and using amino acid therapy. But when you do intermittent fasting, you're actually cutting down the amount of glutamate, the actual food for the cancer. There's a lot of other alternative cancer therapies out there. One which would be really good to research is called insulin potentiation therapy. Insulin potentiation therapy. Look that up. Since cancer lives on sugar, they inject you with insulin, and that drops your blood sugar down. And at the same time, they're giving you a very small dosage of chemotherapy. So when the insulin goes up, the blood sugars go down, the cancer cells get really, really hungry, and they start aggressively going after this sugar in the body. But if you put a small amount of the chemo with the sugar, they will take the lion's share of that, and your cells, the healthy cells won't get it, but just the cancer cells will, and you can kill them off that way. It's very interesting therapy. It's worth researching. Number two, realize that the way that 90% of people with cancer die is through the cancer spreading through a malignancy. And many times it travels into areas of inflammation. So if you can reduce inflammation, that can slow down the spreading of cancer. How do you reduce inflammation? You take higher amounts of vitamin D and you do intermittent fasting. Okay, number three, hands down, the most effective and most powerful chemoprotective, in other words, something that helps to protect against chemo, polyphenol, that's a plant-based chemical, is called EGCG. It's a very long name, which I'm not going to pronounce, of a phytochemical in green tea. Green tea, compared to anything, has the most potential protective factors against chemicals. And the other very cool thing about this protective property in green tea is that it reduces glutamate, the actual food for cancer. So it will protect against the chemo. It lowers glutamate. It can decrease the spread of cancer. It can also decrease the tumor size. So if you decided to chemo, you should be on green tea. Also, as a side note, taking green tea will not minimize the effect of chemo. And on top of that, there's two additional things that I would recommend. Chlorophyll in the form of wheatgrass, juice powder. That can actually protect you as well. And cruciferous vegetables. All right, thanks for watching. Hey, if you're liking this content, please subscribe now, and I will actually keep you updated on future videos.